Hello, my name's Chris. Welcome back to the channel, and this is video number 2 of my ongoing video series of my journey with young onset Parkinson's disease, and as I prepare for the next phase of treatment, which will be deep brain stimulation surgery, or DBS. I thought about going back to the very beginning and kind of walking you guys through from the start, about symptoms that I was having, the testing, which is, a lot of testing actually, to go into what we call a clinical diagnosis of the disease. Talk a little bit about the pharmacotherapy, the different types of drugs one might be expected to take, physical therapy, which is huge, occupational therapy, speech therapy. There's all kinds of stuff that goes into this disease, right? But something came up in the news yesterday I thought I would spend a little time on, and this will get into therapies as well. The singer Dion announced that she is retiring from the public, her public side of her life due to SPS. And I believe there's probably a more clinical name for this. I would imagine there has to be. But the vernacular use of her neurological disorder is stiff person syndrome. And, they say that this disease that she has is incurable, but can be managed to lessen the effects of the disease. And basically the disease, the person gets so stiff, it's almost as if they're trapped as a statue eventually. Sounds horrible. It sounds like dystonia at its absolute worst. I'm not sure if the way in which that comes on, the onset and the machinery, if you will, of that disorder is the same as the dystonia that Parkinson's patients deal with. But it definitely sounds like it could be similar. I need to do more research on that. But this is, stuff like this, whether Neil Diamond recently came out to tell his fans and public that he also has Parkinson's disease. I remember Ozzy Osbourne when he talked about having Parkinson's. And of course, Michael J. Fox has done so much for this community. And of course, Muhammad Ali, no longer with us. He has passed on. But yeah, dystonia. What is dystonia? Dystonia is when or for me, I'll talk about in terms of my Parkinson's disease. The signals from my brain, because of the lack of basal ganglia nerves within the limbic system of my brain, so we're talking subcortex of the brain, the basal ganglia neurons have died off, and therefore my brain does not have a way to uptake dopamine naturally. I hope I'm saying this right. And so therefore, especially on the left side of my body, but now it's bilateral, it's both sides, my muscles will engage, and there's no dopamine there to tell them to disengage. So they will engage and stay engaged, and that of course causes mild to severe pain depending on the load on that muscle and whether or not the muscle actually can lock up. It's called trigger points. I get that quite a bit in my left trap muscle, both rhomboid muscles in the middle of my back. Sometimes the muscle right here, you can see right there, sometimes that will load up and lock, and that's super painful. Can't turn my head kind of thing. Get it a lot in my left foot, my lower left leg, which we'll talk a little bit about that. That's a new troublesome area. But I think I mentioned in my first video that I just recently got back from Gainesville for Botox injections, which is funny. Botox, everybody immediately thinks of the cosmetic use of Botox. This is a little different, my friends. The Botox that you would get from for cosmetic purposes, it is a syringe, and they inject the Botox, but it's only like 1 to 2 layers of skin deep, 9 layers of skin, and it's very surface, right? for Parkinson's patients, the toxin, it is a toxin, a neurotoxin, is injected intramuscular. So they'll use a device that measures the electrical function in the muscle to be able to tell whether or not they're actually inserting the Botox toxin in the correct area to give the patient relief. It can be painful. The injection sites are a little like, it can be a little sore, depends on if you jump, right? So if that needle pushes through a trigger point, you're going to feel it. You're going to jump the first few times, so you get used to it, and sometimes you just can't help it, right? If you've ever had dry needling done for trigger points, it's exactly the same sensation. It's that instant, that hurt, the pain you feel when it pushes through that trigger point, and then it kind of like melts away from the incision site, kind of like a pat of butter melting over something hot. That's the sensation everybody kind of uses to describe what that pain, that aching pain feels like. But you go through a little bit of pain to get a whole lot of relief. Typically within 3 to 5 days, the Botox really starts to work and muscles really relax. And what the Botox does, it's basically putting your muscle cells to sleep and even destroying some. You get some muscle atrophy from it with long-term use, which is why I'm not using it in my left lower extremities. My calf muscle, the muscles, the small muscles on the outside of my lower left leg, my foot, ankle, not using Botox for any of that. I just kind of grin and bear it with the dystonia pain down there. For one, Botox injections for the foot, they have to go into the arch of your foot, the bottom of your foot, and that's like the most painful place to have anything intramuscularly injected. Second, I'm a young onset Parkinson's patient. I turn 47 next week, and muscle atrophy in the lower body, the legs, feet, ankles, knees, it's not something that you want, right? Because it can lead to some mobility issues later on in life. So we hold off on that as long as possible. But I'm unsure with the SPS that Celine Dion was diagnosed with if Botox is even a possibility with her disease. I would have to look into that some more. I'm sure we'll be hearing a lot more about it. It's a very rare disease. They said 1 in a million have the disease. And I know just from being up and aware of Parkinson's research, clinical trials going on, the search for a cure, search for better therapies for folks. A lot of times, these rare neurological diseases, they will focus research on those areas, and it may not help that particular disease, but a lot of times the stuff that they do in the clinical trials will bleed over, and it'll help an ALS patient, or it'll help a Parkinson's patient. And it's pretty interesting how that works in the neurological field. But yeah, I just wanted to kind of touch base on that today, and we'll get back into the next video. I'll talk a little bit about what I did after diagnosis. So everybody have a great weekend, a safe weekend, and I'll look to see you back here Monday. Go ahead and hit that subscribe button, click the bell for notifications, and like the video if you will, and I'll be talking to you soon. Have a good weekend.